Welcome to the Fall 2016 Convocation for the School of Public Health. At this time, I would like to ask you to silence your phones, and I would also like to take the opportunity to introduce our Dean, Dr. Michael Erickson.
Good morning. It's a great day when we have our commencement ceremonies and celebrate the accomplishments of our graduate students, and looking forward to the future and what they're going to be accomplishing. This is a special day for me. This is the first graduation I've been to since my own son graduated from college, and I missed the last commencement in May to attend his, and it made me realize how proud I was of seeing my son marching across the stage, receiving his diploma, and what an accomplishment it was, and how proud I was. And those of you, the parents and spouses and children of the graduates, I know you're sharing that pride. So let me start by saying, first of all, thank you, parents and special people in the students' graduates' lives for your support and the pride that you have. And they couldn't be getting the acknowledgement that they will today without your love and support. So thank you all for that. I just want to make a few remarks, and especially about the changing view and accomplishments of the university, and the fact that all of our graduates today need to fully understand the pride that they should have in getting a degree from Georgia State University. I've been at Georgia State. I came here in 2002 after a career at CDC. And during the time I've been here, the university really has undergone a transformation in almost every possible way. The physical plant, its growth. Just this year, you know that the university has consolidated with Perimeter College. The number of students has gone from 30,000 to 50,000. Georgia State's one of the largest universities in the nation now. In addition to consolidation with Perimeter, there's also, we're in the middle of the acquisition of Turner Field property, and the university will be expanding in terms of its physical location. Two major real estate and academic consolidations and collaborations that just happened this year. But when you look over the last decade, the university has been remarkably successful in two areas. The first being in student success, and that graduation rates have increased more than any other university in the country. And most recently, Georgia State has eliminated all disparities in graduation rates among racial and ethnic groups, as well as around income and socioeconomic status. So students, regardless of their background, whether they're first-generation college students or regardless of the color of their skin, regardless of their socioeconomic status, all students graduate at the same rate, which is about 20 points higher than it was 10 years ago. And the university feels, rightly so, that Georgia State is really the only university in the country that's been able to accomplish this type of increase in graduation rates, graduation success regardless of position, and we're extremely proud of that. And that, when you look at the fact that at least statistics are all at the undergraduate level, but that 60% of the undergraduates at Georgia State receive Pell scholarships, Pell Grant awardees. And Pell Grants are, you have to have a family income like below $37,000 to receive a Pell Grant. 60% of the Georgia State undergraduates fall in that category, and their success in graduating is no different than students of more prosperous families. And that's been a major accomplishment of the university, a source of incredible pride for the university and recognition by President Obama, by the Gates Foundation, by other foundations that have given money to the university to try to expand and maintain this success. As you'll see as our students cross the platform to receive their diploma, our students are no different than the undergraduate students. We're extremely proud of all of them. They represent all races and ethnicities, and our students, if anything, are more global, where students come from all over the world to come to Georgia State to receive a degree. So be proud of the fact that you have a degree from Georgia State. It will have increasing value to you over the years. And the other major accomplishment that's occurred simultaneous as this effort around student success has been the issue about research success. The university has doubled its funding on research projects over the last couple of years. It now exceeds $100 million a year in peer-reviewed competitive grants that the university gets to further knowledge. Much of it's in health. Half of the research funding is around health. We get a good share of that. And the reason I mention it, it really is remarkable for a university to excel simultaneously in student success and in research. Usually it's one or the other, but not both. And the university has been successful and is getting, again, recognition for accomplishments that benefit graduation rates for all students, as well as to advance the research portfolio. And for these reasons, and I'm very sincere about this, being a graduate of Georgia State University, the recognition of that will only increase over time, and it'll be something that you can be very proud of and will help advance your careers. So the university is doing well. There's a lot of energy and very strong leadership to continue this path. And the School of Public Health as well is exceeding expectations in terms of number of students and credit hours. This year has been a particularly important year for us in that we received our full accreditation as a School of Public Health in June of this year. We've been accredited for the last 10 years, but at a lower level as a program, and now there are 50 schools of public health in the country that are accredited. Now we're one of the 50 schools of public health. So we're very proud of that accomplishment. That was this summer, and then in August we started a bachelor's program in public health, which we never had before. And so we're not experimenting, but we're going forth into undergraduate education as well, which is a big challenge for us and a big opportunity, because there's much interest in public health in undergraduates as well as in graduate students. And Atlanta really is the premier location for public health in the world. Some of you already are sitting before me, maybe working at CDC or other public health agencies in Atlanta. And most of our graduates go on to the largest employer of our graduates is CDC. So I worked there for over a decade. It's a world-class organization, and we're all very proud of having it in Atlanta and knowing that it's an opportunity for very meaningful and important work. And many of you will either are currently there or will be going there in the future, as well as having our global leaders here in the class. We've had over the years about 60 Fulbright scholars come from around the world to study at Georgia State, and some of you are in the audience today, and we couldn't be prouder of our international scholars that are here. So let me just summarize by saying the university is exceeding expectations. It's something that having a diploma from Georgia State will have increasing value. You're an important part of the success of the university in terms of where you come from and what you do and the difference you will make. the School of Public Health specifically is very on a very strong trajectory of expanding our degree programs, of receiving recognition in terms of accreditation, in terms of our own profile, the quality of our faculty. We brought in 6 new faculty in this semester. Some of them are here before you, who are coming from all over the world to join Georgia State, to teach you and to help mentor you and develop your career so you'll get the skills you need to be successful and make a difference. So it's a very, very proud moment for me to be up here to recognize your accomplishments. And with that, we'd like to hear from some of alumni as well as students to kind of reflect on what your experience and aspirations are. So with that, I'd like to introduce Rodney Lynn, Associate Dean for Academic Affairs. Thank you.
Good morning. I have the pleasure of introducing our student speaker this morning. Raylene Lewis is graduating from the MPH program with a concentration in biostatistics and a 4.07 GPA. Her thesis is titled Exploratory Factor Analysis of the Trauma Symptom Checklist for Children, a comparison of 2-factor extraction methods. Throughout her program, Raylene has served as a graduate research assistant where she examined the effects of trauma on the mental health of children and adolescents. She also served as a graduate teaching and lab assistant for the Fundamentals of Biostatistics course over a span of 4 semesters. Raylene completed her practicum at the Centers for Disease Control and Prevention and the National Center of Environmental Health with a focus on nutritional biomarkers and complex survey analysis. She has been offered a position as an ORISE Fellow and will work in the Division of Viral Diseases, researching human papillomavirus. Please join me in welcoming her to the podium.
Good morning. Thank you, Dr. Lynn, for the introduction, and thank you to the School of Public Health for the opportunity to speak today. Candidates, we're one quick tassel turn away from being able to add 3 letters after our name. Whether it be MPH or Ph.D., those 3 letters show the world that we have the hard work, grit, and desire to persevere through years of additional education to achieve our professional goals. Being the typical public health student I am, when I was asked to speak at Convocation today, I immediately started to do my research. I wanted to know what a public health convocation speech was supposed to sound like. I learned that most speeches start with definitions of public health, but today we're being acknowledged for earning graduate degrees in public health. We know what public health is. I'm sure we could all recite the story of John Snow and the cholera outbreak in London to anyone who cared to ask. But for the friends and family in the audience, public health is the science of protecting and improving the health of families and communities. As students, what we've learned is that this definition encompasses pretty much everything. Instead of discussing what is public health, I decided it was more important to discuss what is public health at GSU. To me, public health at GSU is spending hours reading how we do harm and writing research papers in systems of healthcare. It's reviewing the health belief model before the social and behavioral exam. It's calculating Z-scores and finding p-values in Intro to Biostat. It's spending hours just finding a data set to analyze for the statistical computing project, and that doesn't even count the time it takes to do the analysis and write the report. It's counting the number of healthy snacks in a vending machine and research methods. It's reciting the interpretation of an odds ratio in Drs. Casanova and McGee's epi-methods classes until you know it so well that you could say it in your sleep. It's spending hours in the biostats lab working on assignment after assignment thinking that these cannot get any harder while you're blatantly ignoring the fact that you still have a thesis to write. It's sending Jessica a timesheet and an update on your practicum hoping you can remember to write everything that you've actually done down. And most recently, it's getting that beautiful email from Gina that says, "Congratulations on completing your defense." At the time, these all seemed like one more task to complete in order to graduate. I never realized the bigger lessons I was learning. Now when I see a research study, I think, how does this fit into the bigger picture? Could this have been done a better way? Who do these findings actually affect? Most importantly, I learned how to talk about public health. Once I learned what public health was at GSU, it became very obvious what I loved about our program. To make one small public health difference, it takes a chain of diverse people. GSU promotes and produces classes of students that encompass that diversity. It starts with our faculty. Just to provide a small snapshot, we have faculty that have degrees in psychology, music, environmental sciences, statistics, engineering, public health, and sociology. The scope of their research interests is even more broad than the scope of their academic achievements. Their willingness to embrace that diversity is what allowed us academic freedom at GSU. We weren't all restricted to a single definition of public health. We had opportunities to cater our courses, classwork, and research towards topics we were actually interested in. I learned so much about the breadth of public health just by seeing what my peers chose to study. This diversity extends beyond research interests and into career goals. There are so many different roles for public health professionals. There are biostatisticians, program coordinators, epidemiologists, health educators, research assistants, policy analysts, and the list goes on. I am a numbers person. The perfect job for me has me solving problems, coding, and running analyses. And the hardest job for me has me writing and interpreting policies or implementing programs based on those policies. I can crunch the numbers, pass along the information to an epidemiologist who makes sense of the findings. Then I get to watch their findings be implemented into impactful programs and policies. This is what I consider the chain of public health. Without the policy and program-oriented people, my analyses would be meaningless. But my analyses help provide scientific evidence for program implementation and evaluation. I love that GSU produces a diverse student body that includes young professionals at every link in the public health chain. GSU helped me realize where my chain is, or where my link is in that public health chain. Now that we're all young professionals, we're in a position to find out where our place is at, but we're also in a position to watch the entire process in action. I recently started as an ORISE fellow at the CDC, and I've been able to see the public health chain firsthand. My team studies HPV and HPV vaccination rates, and my role on the team is to run analyses to determine the national prevalence of HPV and to see if vaccination is actually decreasing that prevalence. It's the perfect job for me. My team members bring me their questions, I write the code, I run the analysis, and I hand them back completed tables. That's my role in the public health chain. A few weeks ago, 2 of my team members presented to the Advisory Committee on Immunization Practices, where they presented a recommendation for reducing the number of HPV vaccinations from a 3-dose to a 2-dose schedule. Physicians and scientists on the committee discussed the benefits of the new recommendation. More people will get vaccinated. It'll be cheaper from a healthcare perspective. Parents don't need to schedule so many more appointments now. I was able to see how analytic studies provided meaningful interpretations that were combined by my colleagues to produce a single policy that will hopefully help improve HPV vaccination rates in children across the country. This is the public health chain. When I started at GSU, I barely knew what public health was. GSU has answered so many important questions. What is public health? How do you talk about public health? What does public health include, and how many people are needed to make a public health change? The GSU School of Public Health faculty and staff has done a tremendous job at helping us answer these incredibly important questions before we go on to make our own contributions to the field of public health. Their dedication to teaching has given us the knowledge to find our own place in the public health chain. On behalf of the class of Fall 2016, I thank you. And thank you to all the friends and family and mentors that have helped us reach this point in our careers. Your support makes the world of difference. Class of 2016, we are only moments away from being able to sign our names with a comma MPH or comma Ph.D. The best part of our newly earned signature is the break from all the homework and studying that it took to earn it. Good luck and congratulations. I'm looking forward to hearing the amazing things our class accomplishes.
I now have the pleasure of introducing our alumni speaker, Lindsay Broussard. Graduated in 2012 from the MPH program with a specialty track in prevention sciences. Her thesis, chaired by Dr. Monica Swan, was titled, "Does the Gender Inequality Index Explain the Variation in State Prevalence Rates of Physical Teen Dating Violence Victimization?" And it was recently published in the American Journal of Preventive Medicine. She completed her practicum in the Division of Violence Prevention at the Centers for Disease Control and Prevention. She was also a recipient of the Georgia Health Foundation Scholarship while she was a student in the MPH program. Today, Lindsay is a program evaluator in the Division of Cancer Prevention and Control at the CDC. She recently completed the Presidential Management Fellowship, a government-wide training program for emerging leaders in federal agencies. During her fellowship, she completed a 6-month rotation in the U.S. House of Representatives with the Committee on Natural Resources, where she worked to bring a public health perspective to environmental and conservation issues. Please welcome her.
Good morning, everyone, and and congratulations to all the esteemed graduates. This is an awesome and important accomplishment. Now, I know when you were in the throes of your thesis or capstone or dissertation and you were wanting to throw your laptop off the 8th floor window of the Urban Life building, it was probably hard to remember this. But a graduate degree is an honor and an accomplishment owned by very few people, and now you are one of them. I know your family, friends, and professors are all extremely proud of you. Now, before I go further, I just feel like I need to admit something. When I was asked to come here to speak to you all today, I kind of felt like I was maybe being punked. I don't feel like I would necessarily be the person I would have imagined to give career advice to anyone. I think I would have imagined someone who knew that they wanted to do public health since day one. I don't think I would have imagined someone like me who changed her major 5 times in college, including art. That was my advisor's favorite. And I certainly didn't think it would be somebody who used to jump from job to job every other year, ranging anywhere from being an 8th grade counselor to working in a DNA paternity testing lab. I really did that. It was just like the Maury Povich show, so not as fun because it wasn't on TV. But then it dawned on me. My roundabout path to public health, I don't think it's that unusual. In fact, if I were to guess, I would imagine that many of you came from different backgrounds before you came to public health. And those backgrounds could range from anywhere from education to law to nursing to paternity testing. And frankly, I think all these different perspectives is what makes public health such an amazing field to work in. Every day of my job at the CDC, I get to benefit from the skills of people who carry expertise from so many different fields. And it truly enriches our work and makes it stronger. So no matter how different your background may have been before you came to public health, don't be afraid to showcase that and use it as an asset. Believe it or not, when I got to work on the Ebola response and create data presentations, I actually got to use that art major. I also want you to know that you've chosen one of the most important and most interesting jobs on earth, and I can say that because I've had so many jobs. Public health touches so much of what you see in the news right now, even when it seems unrelated at first glance. Just as an example, as Dr. Len mentioned, this past year as part of my fellowship, I did a rotation with Congress in the House Committee on Natural Resources. And I was a little worried at first that natural resources didn't really scream public health. I was worried that it wasn't going to have a whole lot to do with my training. But it didn't take long before I realized that the committee really needed someone who could tackle environmental issues like climate change and biodiversity from a human health perspective. And that's because really no matter what the issue is, people always want to know, does this affect my well-being? And if it does, how can we prevent it? So don't be afraid to explore the vast world of public health and a little beyond. With your training, the opportunities are truly infinite, all the way from the federal government and international NGOs to a local health department or school. And now more than ever, we need a strong public health workforce in every corner of the world. So for those of you who will be staying in Atlanta, please stay in touch with Georgia State and the School of Public Health. Please sign up for the alumni listserv, join the alumni Facebook page, and join us at meet-ins for happy hours or other social events. The alumni network really can be one of your greatest resources, whether you're looking for a job or you're already in a job and you just need help with something. And of course, next fall on the Saturdays, please come out to the Georgia State football games and watch the Panthers beat Georgia Southern once again for the 3rd time in a row. It's not bragging if it's true. And for those of you who will be leaving Atlanta, please don't be afraid to show your Panther pride to the rest of the world. When I was in DC this past year, I'm a little disappointed to say that I met a few people who weren't quite familiar with Georgia State yet. But don't worry, I quickly reminded them, and I hope you will too, that this is the Georgia State that was ranked the 4th most innovative university in the nation. And this is the Georgia State that the New York Times and the Gates Foundation featured for being able to graduate first-generation and low-income students at the same rates as others. And this is the Georgia State that believes in a beautifully diverse student body, believes in its accomplished faculty and staff, and most of all, believes in its School of Public Health graduates to get out there and make the world a healthier, happier place. Thank you so much for having me. Congratulations.
Thanks again, Lindsay, for those very inspiring words for our graduates. And so now, perhaps a moment many of you have been waiting for. It is time to recognize our Fall 2016 graduates. At this moment, I will ask the graduates to rise and follow the directions of Lynette. And this may take a few moments to get lined up. And as our graduates are lining up, I just want to take this opportunity to say a personal congratulations to each and every one of you, coming through the Office of Academic Assistance, through graduate admissions, all through advisement, and now to graduation. So very proud of all of our graduates here today. We will first recognize the Doctor of Philosophy degree that was conferred to our graduates. So we have our very first graduate. If you would please rise in honor of our graduates, please. Thank you. Dr. Mogus Ito. And next we will begin to recognize our MPH graduates. And our first one is Uluwatoyin Adedapo Jimo. Bianca Anderson. Lynn Anderson. Shauna Bronte. Kenyatta Bruce. Young Ruchi. Jasmine Cunningham. Amy Sergey Dolly. Elizabeth Davenport. Bernice Edward. Ariel Edwards. Sheila Grami. Rachel Hopper. Raylene Lewis. Garrett Mann. Carolyn Malone. Naisha McDowell. Jeanette McFall. Alexander Kulichi. Catherine Mathoni. Ugo Okike. Jasmine Rockwell. Connie Russell. Sydney Smith Graham. Ashta Vashish. Sonia Williams Aguirre. Congratulations to each and every one of our graduates. At this time, I'd like to invite Dean Erickson back to the podium for closing comments.
This is a very, very special time, and first of all, just one more round of applause for the graduates. And graduates, I think you deserve to give you should give a round of applause to those who supported you to get as far as you have. And so to thank your parents and sibs and kids and friends, please. Let me just say a few closing remarks. First of all, this is just an incredible honor for me to shake the hands of the graduates. And I think you can can understand the feeling of honor when you hear from people like Raylene and Lindsay, who share what they have done and what they've accomplished and what they will do. And to see these bright, shiny faces. And this is the future of public health. And the future of public health is before us, and the graduates and their regalia are going to go forward and make a difference in people's lives. This is not an unimportant degree, and your opportunities that you will encounter going forward will make a difference. I was, when Raylene was talking about her work on human papillomavirus and vaccination, it sounds, academic, and who knows what that really looks like or why it's important. Well, the other day I was doing a radio interview on my area of smoking, and there was a oncologist in the green room waiting to go on the radio who, her specialty was head and neck cancer. And I asked her, what's the biggest challenge in her field in terms of what does she do to help people who are afflicted with head and neck cancer? And she said, well, there's been a great increase in head and neck cancer. And I was like, well, is it because of smoking or alcohol, which are the traditional risk factors for head and neck cancer? And it was human papillomavirus that was surging, manifesting itself in head and neck cancer. And she was a radiation oncologist, and she had to treat these patients who had cancer in their throat, mouth, and neck. And that's important that she does that, and she's very skilled in doing that, but wouldn't it be nice to prevent that? And that's the type of work that Raylene is doing, that her work will prevent people from getting head and neck cancer as a result of infection with human papillomavirus. Lindsay's work and being in Washington and working in Congress on the effects of the relationship between the environment and health. What could be a more important issue to understand how policies need to be put in place to both protect the environment and to protect health? So these are who you heard from today, just 2 people, but we have we have hundreds of stories of our graduates making a difference in people's lives, and actually changing their life course. So it's a very exciting time, and very much of an honor for me to shake your hand, and knowing that you're going to go forth and do great, wonderful things. Let me just conclude by saying we need all the talent that we have, because the future will be challenging. Public health will continue to face challenges in terms of making a difference in people's lives. And it will require your perseverance and your diligence and your intellect, and to do what public health is all about, which is preventing disease, promoting health, and making a difference in people's lives, whether it's here in Atlanta or around the world. Alexander, one of our graduates today, is from Malawi in Central Africa. He's our second graduate from Malawi. And we have this opportunity to train people and give them career paths that will make a difference at Grady Hospital around the corner, at CDC up the street, and in Malawi in the middle of Africa. So there's such excitement and potential and opportunity, but it won't be easy. It will require everything you learn and drawing upon your own personal strength to succeed. We are here to help. We see your diploma as an ongoing relationship with the School of Public Health, and we not only would like you to stay connected, as Lindsay had said, through social media, but also to draw upon us, and for us to draw upon you in the advancement of public health in Atlanta and around the world. So with that, congratulations, and thank you all for being here today.
If I can have the faculty rise, we will begin to disperse faculty, followed by graduates and then their wonderful family and friends. Thank you so much.